Good afternoon, everybody, and welcome to this week's edition of What's Up Wednesday. This is our 19th episode, and I'm Devin Beavis, and we welcome Kerri Pendley, our Executive Director of Healthcare Strategy, and John and Christine Hamby, owners out in beautiful Temecula, California. So welcome, guys. Thanks for being on this What's Up Wednesday with us.
Yeah, happy to be here.
Thank you.
So those of you who have jumped on these before kind of know how it goes. It's kind of just a conversational bit where we take 20 minutes to focus on kind of one core topic that we feel like could be helpful and informative to your business. And if this is your first time with us, welcome, and feel free to use the little chat room that you see on the right that everybody's already saying hello in to ask us any questions or pose any thoughts, comments that you might have. So today, Kerri, I know the focus is on remote patient monitoring, which that's also kind of the same as telehealth, right? Kind of one and the same, a little bit, maybe not.
Not really. No? Yes, it's part of it. That could be like an hour-long discussion itself. So depending, but telehealth, technically the difference and easiest way, you'll hear remote patient monitoring, you'll hear telemonitoring, and then you'll hear telehealth. Telehealth, a lot of times when people are saying that, they're talking about the actual virtual visits with a doctor or a nurse or a clinician of any kind, along with also the monitoring of vitals and things. So that tends to normally clump it all in together. What we're going to talk about today and explain is for the pilot that we're going to discuss with you all, we will be referencing this remote patient monitoring.
Got it. Good deal. Well, I know this is a new partnership of ours. So why don't we just start by you giving us kind of an overview of who the partner is and how it works?
Sure, absolutely. So first of all, as some on the call may know, we attempted to implement a pilot with another partnership. So not to get that confused, for different reasons, that partnership was not working out and was not going to be the best offering for our system. So we started vetting other options. And actually it was John and Christine that this company is near their area and had approached them, and John immediately connected us with them. And so after vetting many, this partner, which is Achieve Health Management, definitely had the most appealing offering. And there were several reasons for that. So happy that John and Christine could join us, because they're going to be able to give you a perspective from their experience so far as our first pilot office to go live, we say, with this. So again, our partner is Achieve Health Management. You'll often hear us refer to them as AHM. We have entered into a 90-day pilot with them, and the reason for that is we've experiencing what we had experienced before. We wanted it to be a set pilot with a certain number of offices for a certain time span to ensure that this partnership was going to fulfill our needs and be able to create the offering they were describing for us to be able to continue throughout the pilot, and then, as long as it's successful, roll out to the rest of the system. And we'll definitely let John and Christine talk about that in a moment, but so far I think we're seeing that they do appear to be a great partner to work with. So the 90-day pilot went live last week with John and Christine. The pilot will cover 6 states, 6 different offices in 6 states. And I see that we have some of the pilot offices on the call. And what was really appealing about this is it's a revenue share, a straight revenue share model. So as with all the other vendors, there was either like a lease agreement you had to sign into, there was out-of-pocket cost one way or another. With this one, as John and Christine will explain to you, it is 0 out-of-pocket cost to the franchise owners. And we can talk more about that. The AHM is able to bill insurance plans, specifically Medicare Part B, as long as there's a chronic disease diagnosis, covers this, and we won't get in the weeds on that right now. But also some Medicare Advantage plans cover it, and then some commercial plans are now looking at it too as well. So there's the insurance opportunity. So it very well may be at no cost to your existing clients or individuals in your community because their insurance would cover it. But if their insurance doesn't cover it, there's also a private pay model that we have available with them. And it's a simple download of the application. It can be downloaded to any smartphone, smart device. And if the client or the individuals do not have a smartphone, then actually AHM has a partner that they can provide a smartphone for free at no cost to the client. So again, there were just many very appealing aspects of AHM in pursuing them as a partner with this. Now, a lot of people say, well, what does that really consist of? What are we monitoring? So the kit, I'm going to refer to it, for the vitals that are monitored, you have basically 6 components. So it will monitor, you get a blood pressure cuff that will monitor their blood pressure, a weight scale, a pulse oximeter, and a thermometer, glucose meter if needed, and an activity tracker. Again, these can be customized to the individual and what their specific need is for the monitoring. And those kits are, and John and Christine can talk more about this, but the kits are deployed, and then depending on, and there's flexibility within the pilot that if FirstLight wants to be the one to go to the home and present that and be the installer, if you will, that's able, you may have certain designated people, or you may have all of your staff trained. That's your preference. And AHM is willing to work with each office on how they best want to set that up. So that's kind of a lot, but that's generally the highlighted questions that we get very quickly about the remote patient monitoring. And so definitely if we have questions in the chat, but I know we also want to ensure that John and Christine talk to us about their experience so far.
Yeah, for sure. And I guess before we get John and Christine's take, you mentioned that that this is going on in 6 states right now. Are those? What were we going to say? I don't want to interrupt you.
So it will be, the pilot will include 6 offices in 6 different states. John and Christine is our first pilot office to go live. I don't want to steal their thunder, but they can report on their clients that they have that have gone live so far, and then what they're doing to continue to add on to that. The next office to roll into the pilot will be Wayne Arrington in Texas. And then we have a rollout plan. And just in case you're wondering, the states that will be covered or included in the pilot are so California, obviously, with the Hambys, Texas, Michigan, North Carolina, South Carolina, and Colorado.
All right, good deal.
Exciting.
So John, I was just going to say, so John and Christine, what has your experience been so far with this?
So far with AHM, they're very easy to work with. We do a call twice a week, Tuesdays and Thursday mornings, and they're very receptive to ideas and suggestions. So it's a good relationship. They're really easy to work with.
It's very collaborative. They're organized. Their products are very reliable. So it's been positive.
And then maybe John and Christine, can you just describe, so you just described they're doing, I'm going to call them support calls twice a week with you. It sounds like working, and I know this from it, but definitely working hand in hand. But maybe describe for us how you have, for like an owner that may think, ooh, how would this even start? What was the first step, second step? Maybe kind of just walk us through your steps so far and your experience.
So we, after the initial meeting with AHM and talking about the process, the equipment, the purpose, we decided the best method for us would be a train-the-trainer model. So they came in, trained Christine and her assistant care coordinator, and now when we do put the devices in the client's homes, Christine's the one that actually takes the devices there when the caregiver is on site, so that she can train the caregiver and show the clients how to use the equipment. And then from then on, it's like a med reminder. So the caregiver reminds the client that they have to take their weight or they have to take their blood pressure, and they assist them if they have to.
I think from the beginning, they came in, kind of saw how we ran the office, and our communication with AHM is by email, and they have created a Google Doc. So as we move forward with our clients and bring them on board and gather the information, it's all in a Google Doc. So we have direct communication, and we share the information immediately. So as we have patients coming or clients coming on board, they see that, then get the devices to us. Eventually, they're going to give us devices to have in the office so that we can then deploy them.
So a stock, you would have an actual stock ready to go.
We'll maintain an inventory. If you want, I can kind of go through the process that we've developed for implementing this.
Yeah,
That would be great.
So what happens first is we started with what we call a low-hanging fruit. Our current clients, most of them, if not all of them, have a chronic condition of some kind. So if they're open to the idea, first thing we do is we have to collect their Medicare ID number and their chronic diagnosis code. Once we do that, Christine puts that in that doc. It goes to AHM, who verifies that they're eligible for this program. And then once we get the go-ahead, Christine takes out the form for
The consent form.
the consent form. The client signs it, and then she basically sets the equipment up, trains the client and the caregiver, and we're off to the races.
Now, AHM decides based on the diagnosis codes and what their chronic conditions are, which of the devices are appropriate for them.
Sure.
Also, there is some collaboration. They may only say they need a BP cuff, but in a couple of cases, I described further their conditions, and then we brought in a couple of other of the devices. So they look at it, but we can also collaborate too on what we think may be best for their monitoring.
and how involved is the training with your team and with the client?
It's really not involved. It's most of the ones we're seeing are the BP, the weight, and the pulse oximeter. So, we're all very familiar. A lot of our clients are very familiar with these, these devices. So it's pretty easy. And really, all they're doing is using the devices as normal because the app immediately captures that reading. So as soon as somebody takes their BP, as soon as it's done, it pushes it to the app, and that's all. There's nothing else to do. So the training is very, very simple.
And so that information goes to the care circle, and the care circle, who's in that care circle, is designated by the client. It could be families, it could be caregivers, the primary care provider, and there's also nurses from AHM that are included in that circle. So if the readings are outside the normative range, the people in that care circle gets alerted, and the nurse automatically calls and discusses the situation with the client, and then they make informed decisions based on the data. What that does is it can eliminate unneeded visits to the hospital or doctor's office. So if the blood sugar is low or something like that, the nurse says, when's the last time you ate, or they discuss it and then plan from there. But it's a way of keeping chronic conditions from becoming critical conditions.
Mm-hmm.
And they touched on two good points there too. So as Christine was describing, for those of you who may have seen other demos of stuff, so it's Bluetooth calibrated, but when she said it's pretty simple, there were other demos that we've seen where it took like 3 steps before it would actually record. This one, right, Christine, it is literally, they just, like the blood pressure or the weight scale, they step on the weight scale and it automatically starts activating that itself. They don't have to go like push or anything like that.
It's immediate. And what we're doing right now is we're kind of working with the clients that we've started to really narrow down what their norms are, to get rid of these out of norm ranges and to really make the data more effective. And then the next step is really to kind of connect with the doctors. So the data is relevant,
Mm-hmm.
So normally, I think what they're doing, am I correct? It's a week. They're getting a week of good readings to get the normative baseline, and then after that, they'll base that. And then the alerts. And as Christine or John mentioned, the monitoring, the 24 hours a day, 7 days a week monitoring is done by actual RNs.
Yes, they will be. So it's very simple. Really, the process is very simple on our end. And obviously, I think once we get out of this COVID situation, we'll obviously have more of our staff maybe doing a little more interaction. But right now, where we are, we don't have much of our staff going in and out of the homes. We've kind of limited. So I'm doing a lot of it, but anybody can be trained. It's very, very simple.
And it's it's in conjunction with normal visits anyway. Christine's out visiting clients all the time, so she drops in, checks the equipment, make sure the caregiver and everybody's up to speed. It's not much extra work.
That makes sense. So how many clients do you have using this right now?
So we have 4, and we'll probably roll out 4 more this week. I think some of our challenges are in the situation we're in, just connecting with clients. A lot of our clients are not the primary contacts. We're having to deal with family, and so we're having those challenges. But generally a good reception. We initially reached out to obviously the ones we thought that would be initially have a benefit for it. We then sent an email out to all of our current and past clients that this was open to them. But a lot of also personal reaching out.
Yeah, that's really smart.
And then I see a question in the chat too about this, but obviously, and you just explained this, you started with your existing clients. I love the fact that you reached out to past clients to capture that. And then am I correct that this will be a part now of your just normal, part of your speaking point about the services you can offer? So if you get an intake call or a referral of any kind or go do an in-home visit, this is something that you will promote or educate about from the beginning?
Absolutely.
As well as all of our referral sources, our chamber, anytime we're, out, it'll just be part of our business model and our services. It's an extension of our care.
It gives us a definite advantage over other agencies that are not offering any value like this. It's an added value, but it also opens doors for networking as well. Now we actually have reasons to go to the client's doctors and talk about the benefit of RPM. And then the doctor gets to know us, and it could open door to other referral sources.
Sure. Yeah.
And John and Christine, also, I think we've had conversations about, let's say it doesn't have to be a client of yours, right? It could be, or even a past client. It could be any individual in the community that has a need for this remote patient monitoring. And then the way the revenue share is set up, again, it'll be how do we track that? But still, if you made that referral, that still is that revenue share goes to you monthly, even if it's not a client of yours.
That's correct.
Correct.
And then we just call and make sure they're doing the weigh-ins or whatever, but it gives us exposure to them to potentially being a client in the future.
Exactly. Kind of gives you a foot in the door.
Right.
Yeah. And looks like Ken Fleming, he may have missed the beginning of this where we did talk a little bit about costs, but Kerri, do you want to go over that one more time as far as what costs are involved?
Sure. And then we've got John and Christine that can attest to this. It is literally zero out-of-pocket cost to the franchise owners, which is just, I know it sounded, John and I, when we were having our conversations prior to the rollout, I'm like, I don't even want to say this out loud and put it out in the universe. It just sounds too good to be true, but it has been. And what'll happen is that 2 times a month, so AHM will bill the insurance company, or eventually when we have private pay, they will do the private pay billing. You will get an itemized statement that shows exactly what they billed for, and then you'll get a check, a payment for your revenue share part of that. So basically you're promoting the offering, making it an extension of your service offerings that you have, and then you get a revenue share from that. On I think it's twice a month you will actually get the revenue share, if I remember correctly.
I don't think we've nailed that down yet, but the beauty of this is there's no out-of-pocket cost to us, and there's no paperwork involved for us except for the consent form.
I think the one key is the criteria is that the client has to have 16 days of readings per month. So, that's, and really in order for it to be valuable for the client, they should have to have at least 16 days of monitoring, to be of data value.
And like you said earlier, the way you see that happening, just like you said, we provide verbal medication reminders now. It's part of the care plan, right? So for those that have the remote patient monitoring in the home, you would educate the caregivers or your staff that this is part of their plan of care and that they need to provide those verbal promptings and reminders to help ensure that they're getting their readings on a consistent.
Exactly. It's like a med reminder. Reminder to put that thing on your finger.
That's a good, yes, that's absolutely right.
Not in those words, but
Hey, if it works, as long as we knew what you meant, the pulse ox. We understand, John. Right.
Well, I don't think we have any other questions.
Oh. Hey, Devin, I think Ken was actually asking what is the revenue potential per client. I'll answer that, and then John and Christine absolutely weigh in. Can actually fluctuate and will fluctuate because, for example, you've got the setup. They can actually bill for the setup, and then you've got certain things that can be billed consistently. But so as Christine and they were mentioning, let's say that there's an alert that comes through, and the nurse that's monitoring has to get involved, and it requires what's called an escalation call. Well, so depending on how many escalation calls there were in that month, the billing, the revenue can vary. But and we have a pro forma for this that we can certainly share. But I think if I remember, and I can access it quickly, and we can follow up on this too. But I think it was $600, and this was for your minimal. It was like $600 per client per year.
Mhm.
And then our revenue share, again, depending on that, but it ranges from literally our share of that is 50 to 60%. Theirs is the 40 to 50.
I think that $600 a year was our share.
Is that okay? Again, I'd have to access that again because we haven't. And like we said, John and Christine, you rolled out your first 3 clients within the past total week, right? And then added your 4th one on this week and then planned. So you're about 2 weeks into it.
right. And these clients, the reason why we kind of pushed really quickly is so if they should get their 16 days in the month of May. So it should be an actual valid, good month.
Yeah. So the end of May will be when your first revenue share
is
generated.
Yeah.
Okay. And this was actually a question that I was going to ask you, Kerri, but it looks like maybe the toppings out in Hawaii have asked this too. So are there any qualifications that an owner would need to think about in order to utilize this program or to be part of the pilot?
So once we complete the 90-day pilot with the designated 6 offices, and especially with what we're seeing, I don't have fear that it's not going to be successful in any way. I think AHM so far has definitely proven to be a great partner. Once the 90-day pilot is completed, that's when we will offer it to the entire FirstLight system. And there's not any, and literally any office can offer this. You don't have to have been open for a certain amount of time or be at there's no to make sure that if you want to offer this, you would need to contact us and we would set you up with AHM to do that. So a brand new office starting up could immediately add this onto their offering.
It's very easy.
Yeah. And Lori also asks, so if our state does not allow us to take vitals, would we not be eligible for this type of program? But I would think since AHM is really the one that's doing that.
We're not taking vitals. Oh, go ahead, John and Christine.
Reminding them to take their own vitals.
So for instance, like the BP, we're not actually we're assisting the client. We're not physically, doing it. We're really reminding, just like we do med reminders. We're not, putting it in their, hands. We're just accompanying as best we can.
Put that thing on your finger. That's what we do.
Yep.
Yes, that's exactly.
Keep it simple, John. Keep it simple.
You should add that to the marketing material. That
Yes.
would be helpful.
Stand on the weight scale.
Put that thing on your finger.
Yeah,
Put the
stand
thing on your
thing
finger
the
and get
floor.
on the scale.
And
Well, we know that it definitely takes guts to go first at anything. So John and Christine, we appreciate you guys going first with this, and thanks for sharing all of your insights with us.
Yeah, I think we'll have a lot of the wrinkles ironed out by the time we get to the next office. So hopefully it'll be easier for everybody else.
Yep. And Kerri, if other folks have interest in this, have questions, what's the best person or resource for them to reach out to?
They can reach out to me directly, and we've had owners already contacting saying, I definitely want to be a part of this when it comes out of pilot stages. So we're starting a list already. So if you know that you definitely would want to proceed, you can email me directly, or as always, we have the General National Alliances email. It's nationalalliances@firstlighthomecare.com. So anytime, we're all connected to that. So anytime you can email that, and all of us will receive the email, or you can reach out to me directly.
Thank you for the opportunity. And I know that Wayne is next. So if he has specific questions, he can definitely just call us directly.
Loving this. Yes, absolutely. And we will, I don't know if Wayne's on, but I will absolutely be communicating that.
Mm-hmm.
So, and you, again, I just can't say enough. Thank you all, because first of all, thank you for bringing AHM to us when they reached out to you. But second, you've just done a fabulous job in implementing this. And within 2 weeks, the progress you've made, it may not seem like much to you, but I've watched a lot of pilots, and especially experienced more and gained more knowledge about RPM in the last 2 years than I ever planned to. And you all have done a fabulous job with that. So thanks a million.
Well, thank you.
Thank you.
Thanks, guys. We'll go ahead and wrap things up. This will be stored in Fran Connect. And thank you to Bianca, by the way, who created a nice little playlist of these on our YouTube page. So that link is in Fran Connect if you want to go back and check out the recording. So thanks again, guys, for taking the time. We'll talk to you next week, where we'll focus on field support, talk about making your business plan. So thanks, everybody. Have a great rest of the week.
Thank you.
Bye.
Stay safe.